morning and welcome to Village in Motion. I'm Marcia Boyles, and I'm delighted this morning to begin our program with George Rallis, who is the Executive Director of the Garden Ridge facility. Garden Ridge, what is it really called? Garden Ridge what? Rehab?
Well, we provide continuing care services.
So it's Garden Ridge Continuing Care?
I think most people in Green Spring know it as Garden Ridge, but Garden Ridge provides different levels of care. We provide assisted living, memory care, skilled nursing, and we also provide short-term rehabilitation as well. Yeah.
Yes. Yeah. Okay. No, I just wondered if it had an official name other than Garden Ridge.
I think most people know it as Garden Ridge, and then the type of services we provide, when we say assisted living, memory care, and skilled nursing, we combine all those and call them continuing care as a whole. So.
All right. Yeah. All right. Yes, we've heard it referred to as continuing care, and that always seems a little confusing. Yeah. All right. Okay. George, I didn't mean to get off on that tangent this morning. Where would you like to begin?
So I wanted to update folks on a few things going on at Garden Ridge. We've had a very busy month. The holiday season's always very busy for us. We have a very busy activity calendar and celebrations and lots of visitors and family members coming in to visit. We had our annual Winterfest, which is our holiday party for residents and for family members at Garden Ridge. We hosted the Winterfest this past Friday, and we had a really great turnout. We have live music, drinks, hors d'oeuvres. We had dancing, and folks had a really, really great time. We actually had several residents from independent living who came to celebrate with us as well, and I think those folks also had a really great time.
How nice!
Celebrating the holidays over with us at Garden Ridge, and so that was a very exciting event. And one thing I'm really looking forward to next year in 2018 is celebrating that same event in a much bigger space in our new construction, which is going to be Dogwood Commons, will be the new addition to Garden Ridge, and we're keeping our fingers crossed that next year we'll be getting to celebrate our that event and many others in the new building that will be open next year.
George, remind us, that will have 90 beds, 89, 90 beds?
So Dogwood Commons will have, I believe it's 89 apartments, and there will be a combination of assisted living and memory care. And so Dogwood Commons will be a residential building. They'll have 4 floors and like I said, 89 apartments, and there will also be some additional amenity spaces like a much larger meeting room where we can have larger group events or multi-purpose activity event space. And also we'll have a billiards room, library, and a few other amenity spaces that we don't currently have today, which will be really nice for residents.
One quick question. Will the number of apartments, I always forget you call them apartments, will the number of apartments in now Garden Ridge, will that change to reflect the new beds, the new apartments?
So today our maximum capacity in Garden Ridge today is 282 beds. And at the end of all of the construction and renovation, which is probably in the year 2021, we'll increase from 282 to 297. So the increase will be about 15 beds. But you might think, well,
all right, because all right, so yeah. Because you're refiguring the other. All right.
Right.
So what I was thinking about was the distribution between the 4 levels of care.
Okay. Yeah. So right now, let's see. I'm trying to present this in a way that will make sense. So today we have 136 skilled nursing beds. We have 102 assisted living, and we have 44 memory care. And with
rehab, 40 some.
No, 44 is memory care. So the rehabilitation is included within the 136 skilled nursing beds. There's a portion of those 136 that is set up for rehab.
Right. Thank you.
So after the construction and renovation is done, we're going to be, I don't know the exact numbers off the top of my head, but we'll be increasing the number of assisted living beds pretty significantly. And we're also going to increase the number of memory care beds a little bit, but mainly because we are projecting moving forward in the future, as you move forward 5 years, 10 years down the road, there's going to be an increased demand for assisted living and for memory care services.
All right, I think that would make a lot of sense to residents.
Yeah.
That's certainly what we're seeing. All right, thank you.
And we've also got some flexibility there that if we end up needing additional beds for skilled nursing and not as many for assisted living, we have flexibility to adjust to make sure that we can meet the needs of our residents.
All right, thank you.
Sure,
for that update. Where are things going with the construction? And
so we're continuing to make progress with the construction of the new building of Dogwood Commons. We are projecting that building will be finished probably in the middle of 2018. And
by
once
summer, maybe?
Yeah, probably in the summertime. And with any luck, we'll have our certificate of occupancy and our licensing approval so that we can start to have residents move into the new building. And that's we're projecting that's going to be sometime in the third quarter of 2018.
Right. Is that Fairfax County that has to approve that, or is it?
There's multiple approvals, but Fairfax County is definitely going to be part of the approval process for the certificate of occupancy. Fairfax County also will be providing the approvals for our assisted living and memory care neighborhoods. So they have a division within Fairfax County that oversees the licensing for those beds. And then also, as we get further into the project, we'll also have the Virginia Department of Health that oversees the skilled nursing.
All right.
Also have to weigh in on as we move forward with the further down the road with renovations. So.
Is it the Virginia Department of Health that also ranks Garden Ridge? Provides the ranking?
So Virginia Department of Health regulates our nursing facility in Garden Ridge. They regulate all the nursing facilities in the state of Virginia, and they do the regulatory activity on behalf of the federal government or the Centers for Medicare and Medicaid Services. And so it's actually CMS who has established a 5-star ranking system for nursing facilities, and that's a 5-star system that applies to all nursing facilities across the country. And the Virginia Department of Health is an integral part of that process because Virginia Department of Health actually does the health inspections of Garden Ridge and of all the nursing facilities in the state of Virginia.
Also examines your records?
Right. So part of the health inspection, they will read resident records, they will interview residents and family members, and they'll interview staff. And when they do that investigative work, they're actually checking to make sure that we're in compliance with all the federal rules and regulations. And actually, what you may be seeing on the screen right now is a website that is medicare.gov/nursinghomecompare. And this is a public website that everyone can go to visit, and they can look and search for Green Spring Village, and they can see the 5-star rating that we have for skilled nursing in Garden Ridge. And
is that done every year, George?
So it's maintained throughout the year, and I believe it's updated quarterly. So the information, the content that produces a 5-star ranking for the facility is updated each quarter. And so there's three main components of a 5-star rating. And the first component is health inspections, like we've talked about, where the Virginia Department of Health does inspections annually and as needed to make sure that we're in compliance. And the results of those inspections are a big factor in the 5-star rating. Another factor that's contributes to the 5-star ranking is the staffing levels. And on the website, you can click on the staffing. You can see the ratio and the hours of staffing that we provide per resident each day. And this information is something that's always been posted to the Medicare website But just recently, Medicare has now established a process where they verify the staffing data that's reported from each facility. And so they actually have a auditing process where they compare the hours that are reported and posted to the website, and also verify that through the payroll data that the payroll dollars actually match up with the hours that are reported. So that's a recent process that CMS has added, and I think it will help to make sure that the most accurate information is posted to the website. And so with health inspections, staffing, and then the third area that contributes to the 5-star rating are quality measures. Quality measures are, an example of quality measures would be prevalence of antipsychotic medications in long-term care residents, or another example would be prevalence of pressure ulcers in long-term care residents. Another example would be the incidence of fall incidents with major injury. So these are a couple of examples of quality measures that are reported, and then based on how our measures compare with other facilities, the quality measures are a big factor into the overall quality rating. So
bed sores and falls are factored in.
Are one of the many factors.
Isn't that interesting?
Yeah, absolutely. As you go to the website, you can see there's a long list of quality measures that are compared, and you can see the comparison of Garden Ridge numbers, our outcomes, our quality outcomes. You can compare those to both the Virginia state average of all the nursing facilities in Virginia, and you can also see a comparison to the national average as well. And one of the big reasons we're a 5-star rated for overall quality is because our quality measures, our outcomes, are far exceed the average in Virginia and far exceed the average across the country. So that's a testament to the high quality outcomes that we have for residents in skilled nursing in Garden Ridge.
George, do you have the sense that the outcomes are based in any fashion on the general health status of the folks that are over there? You know where I'm going with this question. I mean, clearly, Green Spring residents are a fairly exceptional group of people.
Yeah, I think the outcomes. I'm not sure if there's a direct correlation there. What I will say is that I do believe the acuity of care, the complexity of clinical and medical care that residents need here is not as high, and I think that's due to the fact that most folks in Green Spring overall are healthy individuals. They're folks who have had access and have had access to health care, and have maintained their well-being and lived a healthy lifestyle.
And good nutrition.
And I think comparatively to other places where I've worked where that's not always been the case, it leads to a more complex set of clinical conditions, comorbidities, and just acuity of care seems to be a little bit higher in other areas where I've worked.
That would certainly make sense, and that would make the standard of care somewhat different, and that's what you're saying too.
Yeah. Yeah, so I think the standard of care will probably be is consistent from facility to facility, but in terms of the complex clinical conditions, I think the complexity is not as high here, and it may have to do with folks, I think, just having healthy, active lives and the lifestyle throughout their life. And
higher educational, socioeconomic levels, all contribute to
it's probably out of my area of expertise, but I'm sure there's studies that have some correlations.
Oh, absolutely there are, for sure.
Yeah.
Okay, well, this is very reassuring. All of us are very grateful to have Garden Ridge over there, and hope we don't have to use it, but are certainly aware that we may.
Sure,
so
yeah.
It really is a comfort.
Yeah, and I always invite folks to come over and visit, especially those who haven't been to visit Garden Ridge or haven't seen it in a while, or if it's been a few years since you've been over to visit us just to take a tour. We invite folks to come over.
How often do you do tours?
So we offer tours weekly that are a regularly scheduled time weekly. I believe it's Friday mornings, but I don't know the exact time off the top of my head.
Oh, so it's every week.
We offer tours, or if folks want to drop in, we can do walk-in tours anytime. healthcare sales team is available Monday through Friday during normal business hours, but we encourage folks to drop by and visit us. We'd be happy to take you for a tour, even if it's not scheduled. But I always think it's important for folks to get to know Garden Ridge, get to know the folks there.
Yes.
We'd love sharing doing tours with folks so that they can get to see Garden Ridge, get to meet our staff, get to meet our clinical nursing administration, and also our programming staff, because we have extensive programs and events for residents every day, weekends, holidays, you name it. We're doing it at Garden Ridge. So I always encourage folks, if you're not real familiar, to come over and meet with us. We'd love to get to know you.
Well, George, this has been very helpful this morning. Thank you so much for all this information.
Sure.
I think this has been most instructive.
Sure, thank you.
Thank you for coming.
All yours.
Welcome back. I'm delighted to begin this second half of Village in Motion, and this time we're going to be talking about home support. And to begin with, I'd like to introduce Richa Patel. And Richa, you're going to introduce Marilyn and tell us what we're going to be talking about this morning.
Sure. So today I've brought Marilyn Justus, who is one of our registered nurses in home support services. And so she's going to talk a little bit about the nursing services that we provide in home support.
Richa, we might just remind folks, because I think when we think of nursing services, normally we think about home health rather than home support. But you might just give us a little bit of context with regard to home support, that it is, what it includes and the fact that it is fee for service.
Correct. So unlike home health, which is covered by Medicare, home support is private pay. And with home support, you don't need a doctor's order. You can just pick up the phone and call us, and we can provide the services.
All right. And that's aides, that's companions?
Correct. So we have companions, and then we have certified nursing assistants, who are the CNAs, who provide, services such as personal care services. They help with ADLs, meal preparation, medication reminders, things like that. And then we also have our registered nurses who provide the nursing services.
All right. Thank you. Appreciate that.
I'm Marilyn Justus, and I've been a nurse here for 17 years, going on 18 in April.
You must have been one of the first.
Well, in 2000, but we were funny when we were talking, is when I first came, there was just town center. The rest were fields, and there was only one doctor in the medical center, and that was Dr. Branwin. So things have really changed over the last 17, 18 years. I work 2 days a week, and I primarily are out in the field. Most of us nurses, when a resident calls, or family, or a social worker, and wants our services, we then go to the apartment and make an assessment, and that entails social assessment, vital signs, what their needs are, and then we devise a plan, and it's called a care plan, and it lists what the aides need to do when they go into the apartment. If there are fall risk, if there's certain areas that are painful, if they are confused what techniques to use, they'll fix them breakfast, they'll remind them about their medication. If the time allows, they will take them for a walk or just sit and visit with them.
So Marilyn, then you developed this plan of care, and so you're directing the aides effectively in what it is their responsibilities.
Well, and the good thing about the plan is that every 60 days, one of us nurses goes back into the apartment, compares the plan to what the needs are. Sometimes it's changed, like if they don't need to use the walker all the time in the apartment, or if they've switched to a cane, or if the condition has changed, then we update that care plan so the aide then the next day has a change of what needs to be done in the house. And there's no charge for the nurse visit.
All right. Let me ask you one other question. Do you actually then evaluate or in some way oversee the aides in terms of their carrying out the...
We have started something now that we do spot checking, and what we do is we have a form, and the aides don't know that we're coming, and we just kind of pop in and go over a checklist. Are they wearing a badge? Are they presentable? Were they there on time? Have they followed the care plan? And so there's no charge for this visit, and the aides then get evaluated, and if there's something that needs to be changed, we bring it to our clinical manager, and then we discuss it.
And do you ask the resident, has the aide been doing da-da-da?
Yeah, we do, but sometimes it's more doing a check assessment, because I think the resident might be intimidated to talk about the aide in front of her.
Oh, I suppose that would be
Yeah,
true.
she'd be
Yes,
very
that-
careful what she says.
Yeah, oh, for sure, okay. Well, I think that's excellent. I had no idea whether there was, any checking up or not, and I don't think probably most residents have any idea. All right, well, thank you for letting me know that. Excuse me for interrupting here.
No, that's okay. You want to talk a little bit about the medication management?
In most of the nurses, we do something called medication management, and we go into the apartment, fill their cassettes either weekly or bi-weekly. We order their medicines either from our pharmacy, and CVS here has been wonderful, and the pharmacist has filled the medication and delivers it to their apartment. And if they
Now,
use-
when you say cassette,
they're a med box, and it's Monday through Friday. It can be twice a day, it can be 4 times a day, it can be before breakfast, and we fill all the cassettes. Sometimes the resident, once they're filled and dated, they can take them themselves. Otherwise, we have something called medication reminders, in which the aide would go in and actually watch them take their medication.
oh, all right, okay.
And we also do a lot with mail order. So if a resident is on mail order, we order the medication, and if they need new prescriptions, we contact the doctors, either in-house or outside. We notify them to renew the prescriptions.
All right, Marilyn, would the meds come to the resident or?
Yes.
All right.
And sometimes if we are concerned that the resident is going to open the bag,
Right.
pharmacy sends a sealed bag, and it says for home support nurse.
Oh, for heaven's sakes.
And we also have something called a lockbox. If we're concerned that the resident, I had a resident one time that took her Dilantin every time she thought she was going to have a seizure. So we needed to lock the medicine in a box, and we all knew the combination. So her pill boxes and her pills were in this locked box, a metal box. So we would go in, unlock it for safety of the resident.
All right, I can certainly envision that kind of thing. Or just such confusion, not being sure. Okay. All right, this is a terrific service. And absolutely. How many folks do you provide this kind of service to?
Yeah, I think it depends on the different nurses, but we usually do 6 managements a day, and there's 3 full-time RNs. I'm part-time, 2 days a week, so my caseload is probably 16 or 17, but the other ones, I would say on average maybe 30, 35, and that's a lot of responsibility.
All right, so we're talking something like 100.
Probably. Yeah.
All right, again, that's a marvelous service. And again, now that is a patient fee.
Yes. And our fees
What is
are...
the charge?
It's $75 in a visit. Insurance doesn't pay for it, so it's out of the pocket, the same as the care. And it's
What
put
about
on...
long-term care?
It depends if it meets the qualification. I had a resident who was strictly med management, and because of the confusion, she was able to bathe herself and dress herself, but long-term care did pay for it. But I think it depends upon your policy.
Sure, it would.
And that usually goes through our office, and the staff can say what does or doesn't. I don't have any involvement in that.
All right, so aside from occasionally with long-term care insurance, this is all all patient fee.
Yes, and sometimes because of the finance, they choose to do every 2 weeks. If we feel the resident is stable and can do this, then we'll check with the doctor and go every 2 weeks. Most of the family likes us to go weekly because in our visit, we do blood pressure, temperature,
you
listen
do?
to their lungs, check for swelling, see if the condition has changed, and then notify the power of attorney or the medical center.
All right, so you're doing a health assessment in addition to the meds?
Yes, that's correct.
Okay, I can see why families would like that. All right, well, that could be a tremendous benefit in itself, I would think.
Well, and a lot of times the resident thought they took their medicine, or they would go and take the medicine out of the bottles, and so they got in a lot of trouble in overdosing, and so that's why it's a good thing that we put the medicines at certain places.
I was going to say, now, in order to avoid that kind of thing, do you put the bottles someplace inaccessible?
Yes, and we know where the cassettes are kept, and if it needed to be changed, like put above the microwave in a cupboard, the care plan has that listed, that, you know, medicines are above the microwave.
All right.
We tend to put them up higher.
I was going to say that we all know exactly what you mean by above the microwave.
Yeah, or
because
above
we
the
can't
sink,
reach it.
yeah, above the sink, 3 shelves up.
Right,
you know,
exactly,
that type
exactly.
of thing. It's just for safety, and we are standard usually. The cassette might be on top of the refrigerator, or it might be hidden in a cupboard, but that's all listed on the care plan, and us nurses know where the cassettes and the medicines are. It's all written down. And the codes are the same, you know, for the med boxes.
All right. I wondered how you avoided having, you know, patients, residents thinking, gosh, I need to, you know, access my pills. And,
Yeah.
and you know,
Especially
what you did
for
with them.
pain medication, we get real concerned.
I can imagine.
About, you know, the Tylenol 3s and the codeines.
Oh,
and,
yes.
and for an older population, you have to be really careful in what other medicines they're taking.
The combinations and mixtures of...
Yes.
Uh-huh.
A lot of times it affects the blood pressure, so it's a safety issue for mobility, getting out of bed.
Are residents of this age group less likely to be on OxyContin or things of that sort than a younger population?
I can only speak for myself. I don't have anybody on OxyContin. I think some of the other nurses have residents who are on more pain medication. Mine is usually just Tylenol extra strength for arthritis. At present, I don't have anybody that's on them.
I would think there would be some reluctance to, for our age group to be given really strong, potent pain medication.
Yes.
I mean, unless it's extreme. And in that case, I would think a lot of times folks would be in hospice rather than in general population.
Yeah, as I said, I can only speak for my residents. So, and we do a lot with Tylenol. We do a lot with ibuprofen. We try to do those medications prior to anything stronger.
Yes, that would certainly make sense. Well, this has been very interesting. Anything else you'd like to leave us with here?
Well, I just wanted to remind everyone, we have had a special going on in home support since October, where if a resident gets at least 3 hours of services, they get 1 for free. So I did just want to remind all the residents that this special is ending on December 31st.
Oh, it is. So hurry and order your support.
So it's a great you know, time to take opportunity to you know, try out our services. So they have up until December 31st to take advantage of this special.
Remind us, what is the minimum number of hours that one can order a day?
So our minimum is just 1 hour.
All right.
So sometimes we have residents who just use us for 1 hour a week. You know,
Is that right?
correct. Sometimes we have residents who just need us to come in 1 hour a week just to do a little bit of light housekeeping.
Yes.
You know, do
Change
their
the bed
laundry.
maybe, or-
Correct. Correct. So our minimum is just 1 hour.
And what is a 1 hour charge?
Well, our charges do vary, and whenever the nurse does come out to do the assessment, she will discuss the charges with the resident. The more number of hours that a resident gets, the charges are less.
Yes.
And our rates are changing in 2018. But when the nurse comes out to do the assessment, she will discuss it with the resident, just depending on, you know, the number of hours of services that they are getting.
Yes, and we did receive the new rate schedule a few weeks ago, so the rates don't seem to have changed too much.
Correct.
In general.
Correct.
Okay, well, folks, I see our time is up. Thank you so much for coming. This was very instructive this morning.
Thank you for
Thank you.
having us.
Thank you both.